I'm Vernon O'Donnell. I'm the president of field operations at Hipori. We are based in Austin, Texas, but we also have a secondary office in the greater DC area. And what we do is we're a cybersecurity firm that is focused on protecting the edge device. And that's mobile, that's laptop, but really ensuring that there's no data spillage, no data at risk for compromise in all the various ways that can happen.
Yeah, interesting. And so cybersecurity obviously is a super hot topic here at HIMSS and in healthcare, protecting important data and data that's definitely up there in terms of being at risk. Tell me a little bit more about the solution and Hipori and why that's so important.
Yeah, sure. So the original use case was around how do we actually put someone in the field in an environment that they're not supposed to be in necessarily, or maybe that there's a critical mission. They can buy a burner phone and access classified secure mission orders on a dirty network, right? So that was really where this all started. So, but the big concept was, from a national security, but also just from a pure risk perspective, the second most important data at risk right now is personal health information. The number of breaches you're seeing are astronomical. The way people are capitalizing on it from a ransomware and terroristware perspective. So we thought, hey, if we can help the three letters, the intelligence community, the Department of Defense, why can't we also help healthcare really ensure they're securing the edge from a data privacy and data security perspective?
Yeah. And, when we look at, say, in healthcare, there are increasing apps that are, built to be secure, and they've got a mobile app. But, the idea, particularly with, say, imaging or accessing data, they will have, say, the app, and it's great because it doesn't store the images on your device, but, you need to log into it. This is taking it kind of to the next level, right? You're not even, like you mentioned there before, like you've got, say, like a mobile device, it's kind of like VPNing, like back in the old days of using a VPN, but through a mobile phone. Is that right?
Yeah, no, so it's a little different. So we took a unique approach to it, right? So a lot of what folks are doing in terms of the mobile device management or the VPN is there's still actual data on that device, right? It's just managed and containerized data, but it's still there. Think of us as like a streaming encrypted YouTube video, right? So there is absolutely no data. You're interacting with rolling change pixels only that are streaming from a secure cloud. So that there's, again, no data on rest on the device, no data in transit on the device, and the ability to access that information is all controlled by the enterprise that's managing that, whether that's multi-factor or biometrics. So the best way to think about it is if you lose your phone, even if it's VPN or MDM protected, you're not going to call the IT department first. One, you don't have a phone, right? So as long as your phone is lost, that is an open risk. And 40% of all data breaches occur on mobile devices. If you lose your phone and you're using Hipori, there is no way to access that data because that data is not on the phone. It can't be hacked, it can't be traced, it can't be cloned. So that's kind of again, going back to where we grew up, the approach we took was hyper secure because of the nature of what we were doing. And then now that there's such an emphasis on data security and governance in the healthcare space with HIPAA here in the US, but I'm sure, APP, as you mentioned, down in Australia, we wanted to do everything we could to help secure that edge there as well.
Yeah, absolutely. And I guess then that opens up the opportunity for, a lot of clinicians need to bring in their phone, or maybe they're doing stuff out in the field, and I can see a bunch of use cases for that, and I guess that might take the at least alleviate or some concerns from CSOs, or at least comply with a lot of requirements, particularly if they're dealing with, like you say, government data or other use cases.
Yeah, it does a couple things, right? So it allows people to hire and interact with more clinicians, nurses, kind of just bring in that contractor network and ecosystem without having to issue them a phone or go through a laborious IT process of putting them in their mobile device system. So just be able to quickly provide access. But then on the user side, we think there's a big play in helping with, like, there's a burnout problem, right, in this post-COVID world, right? A lot of people working in a lot of different hours, a lot of different environments, and the ability to do simple tasks at home on your device, or even when you're just walking around the hospital, be able to manage parts of your rounds via our application without having to go and log into a terminal each and every time. We think that's actually going to have a significant improvement on those end users. That's the big bet. And ideally anything we can do to help the healthcare industry avoid the burnout problem. I don't know if it's the same in Australia as it is in the US, but last 4 years has not been easy for medical professionals. And so whatever we can do to lessen that burden for them, we think that's a really important area we can play.
Yeah. And then if I'm thinking about, if we make something super secure in healthcare, sometimes that means that it's super difficult to use from an like an end user perspective, because it's really secure that no one can use it, if you know what I mean.
That is all joking aside, that was the problem we used to have, right? It's easy to tell a soldier, someone in special forces, hey, tough, your user experience isn't great. Deal with it. But actually, one of the big reasons we're just now coming to HIMSS and just now really starting to promote ourselves in healthcare is we had a major product release in October to improve a lot of the user experience. So yeah, absolutely. 6 months ago, we were not ready yet. And if I was an end user, I would have been very frustrated. But we put a significant amount of effort in improving the speed, decreasing the latency. As you can imagine, because there is no data on the device, it has to restart every single time. And so we took that from 30 seconds to 3. 3 seconds on a phone still feels like an eternity, but it's a heck of a lot better than 30.
Sure, yeah.
So there was a compromise experience, but we know that's the next frontier we really have to hurdle past as a company.
No, it's a fine balance too, and there's no trying to shy away from the importance of that security piece, and particularly if it's that requirement. And it sounds like it's a requirement here in the US, but you're also mentioning it's a global thing as well. There's opportunities globally for this kind of thing.
I mean, it's a requirement here in the US as much as that HIPAA's a driving force in regulation. But again, the trend you're seeing in a lot of these security events and the data breaches that are happening in healthcare globally is that data is quickly monetizable, right? People, I don't want my healthcare data out there to be exploited, right? And so that's not a U.S. problem. That's a global problem. Whether there's regulations in a various country, everybody should be worried about securing their nation's interest in the way of their personal and private health information.
Yeah, absolutely. Well, then what's on the horizon? You've got the redesign of the product, and here at HIMSS, I think you were on a session as well, speaking about some of these issues. What can we see for Hipori over the next 6, 12, 24? Like, where are your focus areas?
Yeah, so just on a panel a little bit ago today, which was great. We talked a lot about, again, what we're talking about here. Continue to focus on the experience of the product, make that even better, make it feel more and more like a native phone. Because the tech was built on Android, if you're an iPhone user, you're like, what is this? But we've got a design that makes it look and feel a little more like what we're used to, because as an iPhone user, I'm a baby. Sure. So I need to make sure, I don't know, it's important. I'm acknowledging the fact that that's a big piece of it. But we're also looking at doing, there's no text or SMS included in the platform today. And we think that's going to be a key part of that communication and collaboration, or potentially like a pager or push-to-talk experience as well. So we're deep in exploration of SMS messaging or push-to-talk or pager type of products that are still in that secure environment. So none of the data is on your personal phone, but you can communicate in a way that feels like a phone. So that's the next big bet from a product standpoint.
Yeah.